Good evening. Thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. I am Xavier Richardson, the Senior Vice President and Chief Development Officer of Mary Washington Healthcare. For over 120 years, Mary Washington Healthcare has been committed to caring for the Fredericksburg community. We know the COVID-19 pandemic has raised many questions and concerns among the people we serve, and we're here tonight to share with you what we know about COVID-19 and what we're doing to keep you safe and healthy. During this town hall, you'll meet our local panel of experts, and we encourage you to ask questions along the way. To get us started, I'll turn the program over to our moderator, Lisa Henry, the Mary Washington Healthcare Director of Marketing and Communications, who will introduce our panelists.
Good evening, and thank you for joining us. I'd like to introduce you to Dr. Mike McDermott, President and CEO of Mary Washington Healthcare, Dr. Donald Stern, Acting Director of the Rappahannock Area Health District, and Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. For our opening remarks, I invite Dr. McDermott to kick us off.
Thanks, everybody. I'm Mike McDermott. I'm the President and Chief Executive Officer of Mary Washington Healthcare. I want to just start by thanking everybody in our community for tuning in and being interested in what's happening with the COVID-19 crisis here in our Fredericksburg community. So we're going to be very transparent with you tonight and share our perspectives. My perspective will come a little bit from my experience being the chairman of the Virginia Hospital and Healthcare Association's COVID-19 task force. I'm also co-chairing a task force combined with the Virginia Hospital Association and the Virginia Department of Health regarding COVID-19. The supply chain for things like masks, gloves, and gowns has been just severely disrupted in the United States of America and really around the world with this world crisis. And so the supplies that we have taken for granted in our conventional care modes, where we can place an order at 4 o'clock in the afternoon one day and have the order show up at 9 o'clock in the morning the next day, that supply chain has just been absolutely disrupted. And so every single hospital and health system across the country is struggling to have enough personal protective equipment to care for the patients that are in our facilities. It's one of the reasons that have led to the canceling of non-urgent medical procedures and elective surgeries in all of our facilities really throughout the United States of America. One of the things we need to do is preserve those gloves and gowns and masks that would have been utilized during those procedures to care for patients that really need our acute care today. So the lack of personal protective equipment is a significant issue. It's one of the reasons why we are asking our community to make homemade masks for us, and our community has responded very well to making masks that we can use in our facilities for non-patient, direct patient care issues. To have those masks available is very, very helpful. And so I want to thank everybody in our community that has rose to the challenge. We're going to put in front of our community a 5,000 mask challenge, where we're going to ask members of our community to please make 5,000 masks available for us to better care for the Fredericksburg community. Testing I talked a little bit about earlier, but testing has been a significant frustration. There is a lack of availability of rapid resulting testing that we so desperately need to know what is the true incidence of COVID-19 in our community. We're not able to test everybody that comes in for a test, and knowing the true incidence in the community would be very, very helpful. Having rapid results for patients who we think might have it would also be helpful in helping us preserve the personal protective equipment that I talked about earlier, because until we know whether a patient is positive or negative, we need to treat them like they're positive and use all that personal protective equipment to protect our staff and the patient. I also want to talk a little bit about, I know members of the community are asking, what can I do to help? And many members of our community have rose to the challenge, but I do think the most important thing members of our community can do right now is stay at home. Follow the stay-at-home order of the governor. There's one thing you can do when members of the community ask me, what can I do to make sure I don't get COVID-19? Stay at home. Don't expose yourself or go into situations that would increase your risk of getting COVID-19. Maintain social distancing. Stay 6 feet away from others. Stay at home. Don't go out if you don't have to. Those are the most important things you can do, not only to protect yourself, but to protect other members of the community and our healthcare personnel that are called on to care for those members of our community when they get very sick with COVID-19. So I encourage everybody to follow those stay-at-home orders. I know everybody's doing it. The other thing we have to keep in mind is it's not just a matter of hours or days that we need to stay at home. I showed you earlier from those models how the worst is ahead of us, right? The worst lies 4 to 8 weeks ahead of us. So this stay-at-home activity is going to be here for a while, and we all need to kind of bear down and commit with one another to stay at home through the duration of this COVID-19 crisis here in our Fredericksburg community. And so those are my opening comments today. Thank you for joining us again.
About 5 weeks, our leadership team was watching, with many of you in the community, was watching the tragedy begin to unfold in Italy, where the capacity of their health system became overrun and overwhelmed by the volume of coronavirus patients in their communities. We also, about at that same time, started to see the cases occurring in Washington State and then throughout our country, with evidence of community spread within the United States. It was at that point that we decided as a leadership team and at Mary Washington, we wanted to be proactive and not reactive in our responses. And we began to invest in things that would prepare us should coronavirus and the pandemic truly ramp up and reach our community here in the Fredericksburg region. So when we looked at some of the hospitals that were involved with these surges of coronavirus, and we're seeing this in New York right now, particularly their emergency departments become overwhelmed and their ICU capacity. And you hear a lot about ventilators and needing ventilators. So with our emergency department, our emergency department here at Fredericksburg is often at capacity on a good day without a pandemic. We see 200 to 250 patients a day, and we don't have a lot of capacity to see more. So we knew we needed to be able to expand that capacity in a creative way. And we looked at perhaps having a tent where we could maybe expand our capacity. But our team here developed a field hospital using our parking deck, which is right adjacent to our hospital, as a very secure structure in which to prepare to care for patients should we see a surge in our community of coronavirus. And we're very humbled that that was featured on CNN last night. And I just want to call out the many people here who put a lot of effort into planning that up front. And we invested in that in our community before it was truly needed. And we hope that we never will need it here, but we wanted to be prepared. Another area where we're spending a lot of time with capacity planning is in our ICU. It's our goal to double our ICU capacities at both Stafford Hospital and at Mary Washington Hospital here in Fredericksburg. We have access internally to about 71 ventilators, and we're looking at creative ways to create ICU rooms out of rooms that are traditionally used for other things, such as cardiac procedures, post-anesthesia care unit, operating rooms, etc., that would be able to support ventilators and caring for sicker patients. So again, we wanted to be prepared up front. About 5 weeks ago, we formed a pandemic preparedness committee comprised of our senior leadership, but also leaders in our nursing departments, our various ancillary departments, our operational leaders, and medical staff leaders. And we are meeting regularly as we essentially re-operationalize how we do everything at this hospital in order to be prepared to take care of our COVID and coronavirus patients when they're here. Next, I would just like to say about how inspired I've been by our nurses, our staff, and our medical staff and physicians, and how they've risen to the challenge in facing this pandemic. So many individuals have gone above and beyond, offering to chip in any way that they can. We have nurses who are volunteering to be on the front lines and physicians volunteering to be on the front lines and care for our community. We have staff in unrelated clinical fields that want to do anything they can to help us prepare as the number of cases here at our health system begin to ramp up. And again, I'm very humbled by the response of our community. We've had so many individuals offer to do anything from small donations of masks to offering to buy food for our staff and making other sort of donations. There is no way that I could call them all out and give a shout out to everyone, but there's a few that I would like to just mention who've really stood up and helped us. Bowman Brothers Distillery are now making hand sanitizer and cleaning solutions for us. Germanna Community College and the nursing program donated a large amount of protective equipment to our hospital to protect our staff. Harbor Freight offered several pallets of protective gear. The Girl Scouts and many churches have donated to us. In particular, Life Point Church has made us hundreds of homemade masks and donated many, many meals to our staff in thanks. And numerous restaurants in the area continuously are providing meals for our staff as they're going forward. So we just can't thank our community enough. And as Mike had said earlier, we're really putting a challenge for 5,000 masks in order to protect our healthcare providers as they face this challenge. Lastly, I would just like to talk about the canceled elective procedures. Around 3 weeks ago, we canceled elective procedures and surgeries. And that, as Mike had talked to earlier, was to protect our blood supply, which we're seeing in shortage, to protect needed equipment like masks and gowns and gloves that we're going to need as we face the coronavirus challenge, and also to create capacity within our system should we see this surge of patients coming in. But this is going to be going on for many, many more weeks and maybe even months, and as the governor has said, into June. So my concern at this point is that patients may be delaying care that is medically necessary too long. And I encourage people in the community to not push off needed care too long. We've done a lot in our medical groups, and a lot of our private practice has done a lot to be able to provide care to our patients in a safe way while we're facing this pandemic. Many practices already have telehealth capabilities so that you can be seen and cared for in your home by a physician in one of the practices. And we've rolled this out at Mary Washington through most of our Mary Washington Medical Group practices at this point. For those that need to be seen in person, we are making efforts to keep you safe as well. So rather than waiting in the waiting room, you can wait in your car, and then we'll call you when we're ready for you to be roomed. We are screening patients for potential coronavirus at the door, and we're doing extra measures to keeping our facilities clean. And lastly, what we're seeing mostly in our ED is decreased volumes and mostly people with signs and symptoms of coronavirus infection. That gives me concern that many people are delaying life-threatening conditions for a later date. I just want to say our emergency departments are open and they are safe, and don't delay care when you may need it, should you need it.
Thank you, Dr. Newman. Dr. Stern, if you could go.
Well, good evening, folks. I want to start out by first offering my condolences to the family in Spotsylvania County who recently lost a family member. Folks, this is our first death due to COVID-19 in Planning District 16. This is a serious disease. We need to take it serious. So stay home. Follow the orders that have been issued by the governor. And remember, this is a person-to-person transmitted disease. So it's not this monster that's going to crawl through the night and somehow get you. It's transmitted from person to person. And so that individual who's ill coughs or sneezes and transmits those viruses through what are called respiratory droplets to the next individual through the air. Studies have shown that if you're at a distance of 6 feet or more, you're probably okay. Also, you remember that it's contact surfaces that this disease is transmitted by. So on your hands, touching a surface, the next person who comes along, for example, on a doorknob, touches the doorknob, they pick up hundreds, maybe thousands of viruses and then touch their hand, mucous membranes, mouth, nose, and they may contract the disease. Another interesting thing about this is that we're seeing a rise in cases already. Mike already noted that we expect this to continue to rise till May. We started out a couple weeks ago seeing 1 or 2 cases a day. Then it came to 3 cases a day. We've had 8 new cases in the last 24 hours reported to us in this health district. So we're on that upslope. That's going to continue to rise probably for the next several weeks. And then hopefully it'll plateau off and we'll start seeing that come down. One of the ways we're going to continue to count the cases. One of the ways we determine whether people can go back to work, go back to church, start hugging your grandmother again, is once those ICU admissions start dropping off, the number of cases start dropping off, we may be able to ease off. That's going to be a governor's decision, of course. We know from the data that 80% of these cases are mild to moderate disease and can handle it okay at home. But I'm telling you, this is a bad disease. I walked through the emergency room today and visited the ICU, spoke to the physicians in both centers here at Mary Washington Healthcare. I was impressed, first of all, with the professional demeanor of the staff, but also the seriousness that they take this disease. And this is different than the flu or the inflammatory process that you get with the flu virus. This virus can really take you down. And I'm talking about primarily those who are elderly and those with underlying debilitating disease, such as diabetes, heart disease, chronic pulmonary disease, liver, kidney disease. Those folks need to be staying at home for sure. Ill folks, stay away from them. And those folks, elderly and those with chronic debilitating disease, stay away from sick folks. This is a serious disease. So I wanted to also then just mention what we are doing as your public health department. First of all, we do have a call center, and if we would show the call center number, I appreciate that. We have a group of primarily nursing staff who understand this disease, understand the resources in the community, and are quite willing to take your calls and offer advice and guidance. About a half, maybe more of those calls are coming from providers saying, where can I get testing? And I'm going to comment a little bit more about testing in a few minutes. It is a major issue. But we're also helping people deal with their fear, deal with their anxiety around this, and try to help people make practical decisions about this disease. We have a case management and contact tracing team. So anytime a laboratory sample turns positive in the lab, actually providers as well as laboratories by state law are required to report a positive COVID-19 case to us. We immediately then interview that patient, interview the provider, interview the family members, try to find out who the contacts are associated with that case. We contact every one of those contacts to the case, to the patient, sorry, and instruct them on isolation for the patient, quarantine for the contacts, and give them advice and guidance, and then we monitor that. We have them an online tool that they can sign up on. We instruct them about measuring their temperature twice a day, monitoring their symptoms, recording those, and then reporting to us anytime their temperature rises or their symptoms, they develop symptoms for the contacts. So that's our contact tracing. This is the way in which we help to control the spread of the disease, is really reinforcing that isolation quarantine requirement. It goes beyond just staying at home. Our other activity is communication and public relations. We're pretty good at understanding how to communicate about spread of disease and reducing your risk and those kind of technical aspects about mitigating the spread of communicable diseases. But we understand that this is more than that. This is a disease that's brought upon a substantial amount of fear and anxiety in our community. And so part of our message is trying to help folks understand the truth about this virus. And we're all learning it right now about what really is the truth. You wonder. So how many people less than 30 have died from this disease in the United States? Less than a handful. 80% of folks handle this disease fairly well. But I challenge you, look at the ICU up here and look at those folks. It's a bad disease. Our messaging is we're trying to design how to help people allay their fear and anxiety, make practical decisions, as was discussed earlier. What can you do? Stay at home, follow the governor's orders, practice good communicable disease hygiene. Don't cough in your hand, use your cuff or a napkin or some other barrier for your cough. Wash your hands frequently, 20 seconds. Yeah, anybody ever count yourself washing your hands? It seems a little longer than what you may be used to. Wash your hands. Practice good hygiene. Stay at home and be particularly mindful of the elderly and those that you know have some underlying medical condition. I didn't mention immune compromise. Folks who are on cancer chemotherapy, who may be taking a medication that impacts their immune system or their internal defense system, those folks need to take special precautions, as well as those with chronic heart disease, chronic lung disease, liver, kidney disease, so on and so forth. So let's be mindful of those. You young folks who think this may not be a big deal, listen, we all have a responsibility to one another. Let's protect the elderly and those folks who may be at risk for contracting this disease and dying from this disease. Thank you for paying attention to those guidance.
Thank you, Dr. Stern. I'd like to start up with some questions from the audience.
Sure.
We've got quite a few coming in. This first one is going to be for you, Dr. Newman. People are asking questions around how are we preparing for additional capacity? What are some of those steps we're taking? And in that, are we thinking of our workforce differently, those who maybe aren't as busy right now, and how might we use them even in the field hospital?
Yeah. So I spoke a little earlier how we're trying to create physical capacity within our health system. And that was really three ways. Double the capacity of our emergency department by building the field hospital, double the capacity of our ICU by using non-traditional spaces for intensive care unit beds, and lastly, by canceling a lot of the elective procedures, we created some space and capacity within our health system. But that doesn't create nurses or doctors to care for patients. So for our intensive care unit, we're using our anesthesia colleagues, so our anesthesiologists, our CRNAs, are going to help our intensive care physicians step up and care for patients because they have a similar training. And with our elective surgeries canceled, they have some capacity to be able to help. Our cardiologists, our GI doctors, our endocrinologists, some of our medical-based specialties are all agreeing and willing to chip in the hospital to care for patients as well. And we've even had physicians in the community, don't even work for Mary Washington Healthcare, but physicians in our community like family physicians, internal medicine, primary care docs that said, hey, if you need us, we're here, we'll come in, we'll help. We're looking at creative ways to redeploy nurses and staff who are from other areas of our organization, like our ambulatory spaces, our ambulatory surgery center and others, and redeploy people whose job may be going away in the short term as their areas are closed down, and redeploying those folks in our system to where we're going to need them most in our ICUs, EDs, and frontline positions.
There's been a recognition at the state and federal level of the need to ease some of the regulations that we have under typical conventional times to allow those workforce members to practice in that manner. And the fact that the federal government and the state governments have already eased those restrictions to recognize that the need for the workforce demonstrates how serious the COVID-19 crisis is.
Exactly.
And Dr. McDermott, while you're talking, we're getting a lot of specific questions around testing. One of them being, it's very restrictive. Will the restrictions for testing be lifted at any point? But also, there's a lot of different companies out there talking about having testing capability now. Yeah. So are we looking into that? What are our plans around testing at Mary Washington Healthcare?
We are. There's a lot of talk about testing and an improved environment of testing. And when that day comes, we'll be happy to ease the restrictions that we have on who we can and we can't test. But right now, the reality of the situation is, and I like to deal in reality like it is, not how I wish it was or what I hope it is, but the reality is we have very limited capacity to run testing, and that when we do run a test, it takes quite some time to get the results back. Yeah. And that's the reality of the situation today. You do see in the news the Abbott machines, and there are other genetic point of care testing machines that are available where they're talking about FDA approval. And we are researching every one of those options, and we have some of those machines available here in our Mary Washington Hospital facility to run those genetic type tests. We do not have them available here in our community yet. And so, although they have been approved, the general availability of those modules and the things you need to run the test is just not here yet.
Right.
When it is here and they are available, we will broaden the testing as we are able to. That is a commitment we will make.
Yeah.
Don.
Yeah, thank you. I wanted to note that this isn't the testing issue, and delay in testing is not unique to Mary Washington Healthcare. This is a problem across the board in most of our healthcare system. And it's not just what you hear on the news, don't have adequate testing, a number of testing kits. It's actually, it's somewhat complex, but it has to do with the number of machines that are capable of running this test and the reagents, the material, the supplies that are used for running that test. These are in such demand nationwide, worldwide, that it's created a substantial demand. We're asking folks, if you're worried, well, right now, just hang on. You can actually get a test. A provider can run a test on anybody they want. The state lab limits the tests that they will run. They've set the bar very high, requiring that any sample that is sent to them must first be approved by the health department, and that bar is very high. A healthcare worker who's symptomatic, a first responder who is symptomatic, someone who's come into contact with a positive case who's symptomatic, somebody who's traveled to an area that is high density or high risk transmitting area. Been to China, been to London, been to Spain, been to Italy. So those are high priority cases. What's happened is that some of these less priority cases are backing up those laboratory services, and I'm talking about the private labs. You can imagine Quest and LabCorp and other private labs are absolutely slammed right now with the demand for lab testing across the Commonwealth and across the country. So this isn't unique to the folks here. They're trying hard to increase their capacity for lab testing. I was on a conference call for an hour today with your staff and another laboratory out of Ohio trying to figure out whether it would be reasonable to bring their test equipment in or not. So worried well, relax, stay at home. Let's not overwhelm our laboratory system right now. The lab test is, by the way, very important from a clinical point of view because it helps the clinicians decide, well, am I treating COVID-19 or not? It does make a difference because it's different from the flu, pneumonia that you get from the flu. There's different clinical strategies they take. And I have found from talking to the clinicians here is that if a patient has a COVID-19 test positive, they're going to be a little bit more aggressive because this virus is more aggressive on those patients. Secondly, from a public health point of view, we need rapid turnaround on these labs. That is because I told you about our case contact workup and contact tracing. If I don't get a positive lab report until 8 days after that sample is taken, what good is it that I'm doing? We're 8-10 days behind in doing our case management, case contact workup, and advising folks about the high importance of their quarantine and isolation. So we need rapid turnaround on these. So it's one of my priorities, one of the things I'm working with Mary Washington Hospital on, working with others in the community to try to speed up our lab turnaround time. Thank you.
One other comment just about testing that I do want to mention is, although there is a lack of rapidly resulted testing, it is an issue nationwide, not just here in Fredericksburg. it's in the entire Commonwealth. It's a nationwide issue. There was a point in time about a week ago where we were very, very low on our testing capability, even for our inpatients here at Mary Washington Healthcare. And some of our friends and colleagues at Riverside Health System and Centera Health System pitched in and delivered some of their tests that they had available, kits available here to Mary Washington Healthcare, so we could treat members of our Fredericksburg community. So there's a tremendous sense of cooperation and coordination going on throughout the entire state, helping our entire Commonwealth fight the COVID-19 crisis and share the limited resources that we have available throughout the Commonwealth so that we can treat everybody in the best way possible.
Thank you. I'd like to make this question directed to Dr. Newman. What is being done to get our healthcare workers the PPE they need to do their job safely? And also, should the community be considering wearing masks with some of the recent remarks from our federal officials?
So we're doing everything we can to get the protective equipment for our staff. We have been lucky that we did have a supply previously of N95 masks, and we are using those in our highest risk units, but they're not going to last necessarily for the whole length of this pandemic. We're running short on just general surgical masks, and that's why we're pleading for our community to create the homemade masks and donate homemade masks to Mary Washington. But things like gloves and gowns, there's many different things that we need to keep us safe. We have a supply chain that's working, team that's working around the clock to source things from often very atypical places that they normally would not to be able to get these. We've had donations from construction companies and veterinary practices and dental practices, and that's all very greatly appreciated because one of my greatest concerns is really keeping our frontline staff safe as they come to work and as they face this challenge.
One of the roles of the homemade masks is to make sure that we can preserve our surgical masks and our medical masks for direct patient care use. And if there's any other activity where we could not use one of those surgical masks or medical masks, and we could use a cloth mask, we want to be able to use that when that is appropriate and not use up our medical and surgical supplies for those issues. That's why that 5,000 mask challenge to our community is so important, to have that supply of homemade masks. There are plenty of activities around our healthcare system that we can use one of those homemade masks that aren't direct patient care and don't require one of the medical masks. We want to preserve those when we need to use them.
And masks in the community, people wearing masks in the community. I would say, when we've looked at this, there's a chance that you could be asymptomatic before you start having symptoms and be shedding virus. And a mask could help protect some of those droplets from getting out there and you infecting somebody else. So there is some utility to masks in the community. We'll ask, though, that rather than keeping masks in the community, the people at the greatest risk are really our healthcare workers on the front lines, and any masks need to be deployed to them first as they fight this pandemic and keep us safe, and then secondarily the rest of us and those in the community.
Yeah, let me just add to that. If I understood you right, Dr. Newman, you said that if you have an upper respiratory infection, a mask may be helpful for you to wear that to protect others around you.
That's right.
But the evidence is for the general public otherwise, who are not infected, just well otherwise, the mask is probably not, I can tell you, it's not an effective strategy. I'm not going to tell anybody not to wear a mask. If it makes you feel better, if it makes you feel like you have some protection, fine, get your grandmother to make you a mask. But we need to preserve this PPE nationwide for our healthcare providers who are in constant contact with somebody with COVID-19. They need that protection.
Yeah.
Thank you. Dr. McDermott, we're getting questions about how we would cooperate throughout the state. You had mentioned earlier that we've already started cooperating with other health systems. Is there a chance that we could end up cooperating with the DC and Richmond areas where they're have more densely populated, could we see patients of theirs coming to our area if they become overrun?
Yeah, many states, in Virginia included, are working on creating models where we would work with one another to use our intensive care unit capacity and our intensivists and all of our personnel who are highly skilled in treating the sickest patients, that we would all work with one another to make sure every patient is in the most appropriate location to receive care before anybody would have to resort to secondary modes of caring for patients. And so that idea of transferring patients to facilities that have capacity to care for those patients, that work is already underway in the Commonwealth of Virginia, just like it is in many states around the United States.
Thank you. Dr. Newman, this might be for you or Dr. Stern. We were talking about this earlier today. Someone asked his wife and himself received the pneumonia vaccine for seniors, and could this virus be mitigated with the pneumonia vaccine?
Yeah, so this is a different type of pneumonia. So the traditional pneumonia vaccine is not going to protect you from the pneumonia caused by coronavirus. That being said, strongly recommend you getting your pneumonia vaccine if you haven't had it. That's for a bacterial pneumonia, strep pneumonia, pneumococcal pneumonia, but not for the coronavirus, not protection per se from that.
Dr. Stern, this one might be for you. Is there a way to report businesses to the health department if our community sees them not following the guidelines that have been put forth for the governor, or where would they, what would they do about that?
Sure. We've been given specific directive from the governor that if there is a restaurant that is violating the, there was a 10-person restaurant attendee rule. Now that is, you can't have your restaurant open now. You can do carry-out still, or delivery. So we would, if there was a restaurant that insisted on being open, we would have one of our inspectors go by, validate that, and pull their permit. As far as other businesses go, we do not have a statutory authority to take action in those regards. That needs to be through local law enforcement.
Thank you. Another question, a few of them have come in asking, how can the community support frontline healthcare workers? So Dr. McDermott or Dr. Newman?
Well, I mean, stay at home. That's really the thing you can do the best to support frontline healthcare workers. Stay at home, that concept of flattening the curve, making sure that in the Fredericksburg community, those people who do get sick, very sick with coronavirus, stay within our capacity to care for them. Where what you see happening in New York City, the reports there are so many sick patients in New York exceeding the capacity of their healthcare system to care for them. That's when really this becomes a really bad story. But if you stay at home and flatten the curve and lower the level of contagion within our Fredericksburg community, you keep all of the sick people who need our care within our capacity to care for them. That protects our frontline healthcare staff better than anything else that you can do. While you're at home, staying at home, make a mask. Make a mask with your sewing machine or whatever you can, and please donate it. That would be very much appreciated.
Yeah, I think just above and beyond that, it's just the simple things sometimes, just the cards that our staff are receiving, the well wishes, the donations for a meal, pizzas on the unit. This is a long haul for our healthcare workers as they fight this and serve our community at this difficult time. So I think sometimes it's also just the small things, the words, the kind words, the support in general.
And if you do have the financial capacity to make a donation, there is a link on our Mary Washington Healthcare website where you can go to make a donation to help our frontline healthcare workers who are fighting this here in our community.
Thank you. Another question that came in, and I'm going to go to you, Dr. Newman, on this, is how are the patients, the positive patients in our hospital system faring? And how is it going with their treatment? And have we seen any fully recover?
So as Mike had alluded to earlier, we've had 17 patients that came in through our system that were discharged. So people are getting better. And I'm very pleased to say that 2 of our sickest patients in the ICU who are on ventilators or breathing machines have come off those breathing machines and life support and are starting to turn the corner. But most people do not get critical illness. More than 80% of people are going to be able to stay home and be okay. But once people do require hospitalization, they can get very sick. And we are seeing that where even when they're in the hospital on a regular floor for 4 or 5 days, they can take a precipitous change for the worst, requiring ICU care, requiring a ventilator to breathe, and often having a lot of multi-system organ problems, and require a lot of support. But I'm very optimistic that we have the capacity here, as long as we keep the curve down to where our healthcare system has the capacity to care for people. We have the ventilators, we have the staff, we have the ICU beds, that we can do a good job in saving lives. And at least through Mary Washington thus far, we've not had a mortality in the 27 patients that we've cared for in our health system at this point. So.
Thank you. Our next question was, how can people care for themselves at home if they are experiencing mild symptoms? What is the best directions they can receive? There's so many misinformation and guidance online, questioning things about what works and doesn't work. Do we know much about how people can care for themselves? I'm not sure who to direct that to.
Well, I don't want to spread rumors or make a promise of a treatment that isn't going to be effective, and so I'm not going to do that. And so I think everybody knows the general care and condition that they have when they come down, right? And so if you could stay home, and I would say the most important thing is if you have symptoms of COVID-19, right? If you have a fever, cough, or shortness of breath, we know we have limited testing. We're not going to be able to test you. Assume you have COVID-19. Stay at home, isolate, don't go out into the public. Please don't shed the virus throughout our community or infect somebody else who might also come down with COVID-19. And then care for yourself at home like you would when you're typically ill. I would say to seek medical care when you're worried about your symptoms to a point where you think you might need a higher level of care and you can no longer care for yourself. And that's when I would encourage you to come to the emergency department. But if you're able to care for yourself, I would recommend that you stay at home and follow the typical procedures you do when you're sick.
Yeah, I think this is very good advice. But let's remember, who are the people that are really getting injured and dying from this disease? Look at the evidence. So I would second what has been said, but for those who are elderly or have underlying disease, and I've listed those more than once already, those folks ought to be a little bit more cautious in regards to their wellness. When their fever gets above 100.4, it's time to call the doc and say, hey, this is what's going on. Because once this disease kicks in and starts taking over, it can take over very rapidly. So I'm not so worried about the young, healthy folk, but I'm worried about the elderly and those who have underlying disease, as I've listed before. They ought to be more careful.
Those are the patients who are most at risk, there's no doubt about it. But even here in the Fredericksburg community at Mary Washington Healthcare, we are taking care of patients under the age of 50 who are generally healthy and had no comorbid conditions at all, who are currently in our hospital receiving high levels of care. So nobody is safe from COVID-19. Even if you are below the age of 50 and you have no medical conditions at all, we have sick people in our hospital right now being cared for, who are not elderly in comorbid conditions. Those are the most at risk. There's no doubt about it. Those are the most likely to have very severe complications, but nobody is safe from COVID-19. And if you're young and healthy, you can have a very, very serious illness that requires hospitalization and intensive levels of care. So please stay at home and don't spread the virus.
Stay home.
And I would also just like to say, we have a nurse triage line, HealthLink, that people can call and discuss their symptoms and try to get help with whether they should seek a higher level care or not. And that's, I believe it's 540-741-1000.
And they can call our hotline too, the call center. We gave out that number earlier as well.
On the idea of folks who are able to recover at home, we've had a question of people saying, you know, there could be people who are asymptomatic and carrying this disease. If you've had COVID-19 and didn't know, is there a chance that at some point they could be tested to show that they had it? Do we see that coming?
Yes.
Or is that available?
Yeah, I believe so. I mean, there are antibody tests that are coming out right now, and their utility in the acute disease is not really readily recognized within the medical community at this point. But for surveillance purposes, where we can look at the population afterwards and see who had it and kind of get an idea of who may have immunity going forward, that is going to be a possibility, I believe so.
A lot of folks are asking where exactly they go for information on donations to the hospital. We're going to put a slide up, but again, if you want to talk really quickly about where they can go and what donations we're looking for.
So the donations of equipment, masks, homemade masks, at our old hospital building, 2300 Fall Hill Avenue, from 10 a.m. till 2 p.m. Monday through Friday. We have drop-off where you could just drive up with your car, we take your items, you pull through, you don't have to come out, somebody will take those items from you and thank you for your donation. And so we do have a daily drop-off site at 2300 Fall Hill Avenue where you can pull up and drop off those items that you're donating to the healthcare system. We're very appreciative for those donations.
Thank you. The next question I'm going to ask Dr. Newman to answer. We have a lot of folks who are considered first responders, frontline workers out in the community. They may work in the prison system, or they may work as EMS or in provider offices, and they wonder, is there anything they can do, any tips or things you could tell them to help keep their families safe when they're going home from work? And what could they do?
So this is a uniform thing that we're seeing across the country, and a lot of people who are dealing with coronavirus in their professional lives, that could be healthcare workers, first responders, as you spoke of, are concerned about bringing that home to the family. Certain health systems are, they're changing their clothes before they go home, they're showering before they, come and interface with their family. There's not uniform recommendations at that time, but I understand the concerns and the caution because a lot of people feel that they're up for the battle and they're up for the fight and want to serve their community, but they don't necessarily want to bring that home to their families.
I think those are logical steps, and they can be a reassuring sign to your family that you care for them as well, right? So when you come home, you change your clothes, you throw them in the washer, you take a shower before you interface with your family. I think those are simple steps. They're not unreasonable. They seem logical, and I think it's one of those reassuring steps. You can have a message with your family that you care for them.
And I would second that, especially if you come in contact with people who are ill, who have an upper respiratory infection, who may be spreading a virus, whether you know they have COVID-19 or not.
And one last question before we close for the evening. There was a question for PICU services. There's folks here in our community who are concerned about their children and what the services, advanced services, would be for any children who might need care. Where would they be sent for those services?
Well, our PICU and our NICU here, we're very lucky to have the expertise of the physicians from Children's National Hospital in Washington, D.C. They're the physicians who staff our units 24 hours a day, 7 days a week. We have many protocols for caring for the patients here, but should people need a higher level of care, we have the ability to coordinate their care with Children's National in Washington, D.C.
Thank you. We are at our time limit for the evening. I'd like for each of you to offer one last bit. What is your one last thing you'd like to say to our viewers to either ease anxiety or encourage their behavior? And Dr. Stern, if you could go first, what would your advice be?
Sure. Well, again, stay home. Follow the governor's orders. But I just want to give accolades to all the essential employees out there, folks who still have to go to work, and many of them are hidden heroes. And the staff here at Mary Washington Healthcare are pretty high profile because you see them all the time. People see them. But think about the fella at the county water plant who has to go to work because he's filtering water and making it available to you. Think about my staff. I mean, I congratulated them this week for their great work. People don't see them. They hear them on the phone maybe. But they are hidden heroes as well. I even gave them the Golden Toilet Paper Award this week.
Excellent. Thank you. Dr. Newman?
I would just say that I echo the stay at home. In the 20 years that I've been a physician, I've never seen anything quite like this. I'm sure most of us haven't. I have a deep respect for this virus. This is not a seasonal flu, and it should not be taken lightly. Although most of the patients that we are seeing are at an advanced age or have comorbid conditions, here in Fredericksburg, we have younger people without any of those comorbid conditions that are fighting for their lives in our hospitals. So nobody is immune from this virus. Please be safe. Don't get somebody else sick. And then lastly, again, one more shout out to our doctors and nurses here at Mary Washington and our staff who are just tirelessly working around the clock, putting themselves at risk to serve this community.
Thank you. And Dr. McDermott.
I'll just echo that. In medicine, we have a very noble profession. We're lucky to have that. Purpose comes easy for us because we're helping patients in our community at their times of greatest need. But really, what I've seen here with our associates at Mary Washington Healthcare and how they've risen up to face this COVID-19 challenge here for our greater Fredericksburg region has just been an absolute inspiration to me. And so I need to give a shout out to all of our associates and everybody who's a part of our Mary Washington Healthcare team. And that's a very, very broad team, but what they're doing here for our Fredericksburg community is truly an inspiration. And what you can do to best help them and assist them is to stay at home. So thanks everybody for joining us.